AP1 SAW book, there's an activity on page 16 called body systems. And it's been crossed out because you're not required to do that one. But what it's asking for you to do is to list 5 medical conditions with their signs and symptoms for each of the body systems that we have. Now, I don't think it's necessary for you to do 5. That would overwhelm me in that process. But it might be useful for you to do 1 for each of those systems. So think about the health conditions that your volunteers or your clients discuss with you when you talk to them about the potential benefits of kinesiology. So people come in, they already have something wrong with them. That's a common health condition. It doesn't have to be, you don't have to name it big time, like it doesn't have to be complex. It just needs to be something that you might meet in your clinic regularly. So while we don't treat named diseases, for example, we're not treating asthma, we do want to help the client reduce the impact of that disease or that illness on their life. So for somebody who has an asthma disease, we would like to help them feel like they could breathe better or have a better fitness level or, whatever. So we focus on that, but we're not actually saying, hey, I improved my asthma or I fixed my asthma. Another way of thinking about common medical conditions is to say, or health conditions, is when you're asking them, is there anything I need to be aware of before you start muscle testing them? So whatever you need to be aware of, that could be a health condition that you would see regularly in your clinic. The next part of the question is, what is the impact that might have on your treatment plan? Now, in 102, there might be a sense of there isn't really a treatment plan because our protocol is so simple. There's not a lot of depth in what you're doing. You're just basically learning a technique and practicing a technique on a client. But when you get to 103, you start to do more of these mini balances, like the Energizer goal balance at the end of 102. So the more complex these get, the more we need to look at, well, how is it for my client if I'm going to be putting them through this questioning, this goal statement, physical testing, arms and legs, whether I've got them standing, sitting or lying, what kind of impact that would have on their session. We're looking at it very simply. So we're not trying to make it complex at this point because you haven't learned all your kinesiology stuff. We're just trying to say, if you've got anatomy and physiology, if you've got medical stuff going on in the background, as a kinesiologist, you need to be aware of that and start to adapt for that. What I suggested that we would do this morning is that we would brainstorm some common medical conditions that we can look at for each system of the body. Think of an example that matches those systems of what we might see in the clinic. And then we can look at the signs and symptoms of how a couple of those might present. We can look at the ways that we might modify the way we work with that client. So if we were talking about the respiratory system, do you know anyone who has respiratory system issues?
Yeah, well, you just bringing up asthma. My sister has asthma.
Yeah. So when you work with your sister, are there signs and symptoms that the asthma would be triggered in clinic? How would you know?
Oh, like if she gets short of breath or something.
Okay, so she might get short of breath. And how would you deal with that in clinic? Like if you were doing any activity with her and she got short of breath.
Actually, no, I do have one friend. She had to take a puffer. So maybe ask if they have the puffer.
Okay, so check if they've got their puffer. Which is really first aid stuff.
Yeah.
Which you need to do to work with clients.
Yeah.
But another common respiratory system issue is smokers. How would we know? They would tell us. How do we adjust our process? Well, actually, you probably wouldn't adjust it, except you'd make sure that you use goals that aren't focused on I don't smoke, because you're bringing in the negative. It would be I breathe fresh air.
Yeah.
Yeah. So for here, it would be focus on positive choices. If we go to the integumentary system, that's our skin, right?
Like eczema?
Yeah, or psoriasis. So skin conditions, most of the time that will be a visual thing. but occasionally there might be open wounds or sores.
Yeah.
So if somebody had eczema on their hand that left their hand all pussy, would you modify your treatment for that?
Yeah. So wherever, because I know it can get quite like itchy, hot and painful. So you'd want to avoid touching those areas. Yeah. And use a different muscle. But like,
or if you have to touch it, you would either be gloved yourself or that area would be covered.
Yeah.
About the urinary system, very common in young women is urinary tract infections. They've got a UTI. It's not they would actually have to disclose that. You wouldn't know that without them disclosing it.
Yeah.
And it maybe wouldn't be something that they say, hey, I've got this health condition, when you're asking, is there something I need to be aware of?
Yeah.
But maybe they're on antibiotics at the time.
Yeah.
So they might be having medications, which just means some medications will cause switching, and it might take a bit more work to get the switching fixed before you can start working with them. You would still work with them, but you just need to take time to get that right. It might, instead of being a quick fix thing, it might take a couple of goes and maybe some emotions to get that clear before you can work. Cardiovascular stuff, they may be on medications. In the early stages of your BKP workshops, you're not asking about medications, but by the time you get to 104, you get a client history sheet which says what medications are you on. So when they're on medications, you really want to know what are they for. So their medications might be blood pressure, high blood pressure, for cholesterol lowering. A lot of people are given statin type drugs, which have quite a lot of side effects, or they might be on other kind of heart stabilizing medications like beta blockers or calcium inhibitors. We don't have to know about them, but it's good to know, oh, that's a heart medication. So if somebody has heart disease and they were having kind of a constant pain in their left arm, you would start to question that. Rather than just being a muscle thing, you would want them to go for a referral.
Yeah.
You wouldn't just say, oh, I'm going to fix your left arm. So this is actually not this question. This kind of answer is more question 3, the third question of it. Which one, what would you do to refer? So, or who would you refer to? Soreness in the left arm or chest, you would refer to the doctor, the GP, or even the emergency. I've had a client who's comes from massage regularly, and she often has a sore left arm, and her husband died about 4 years ago, and she is really quite brokenhearted. And so that heart pain is reflected in her body, and I've sent her to the doctor a few times, and she keeps getting checked out, and they keep saying your heart is fine, but it's actually broken. And she, she's only 60 something. She's only a young woman, really. So it's a bit, the emotional stuff can come out physically. In the digestive system, what do you know about people with digestive upsets? What?
Like irritable bowel syndrome.
IBS stuff. Would you change how you treat that person based on that?
I don't think I would, unless if they get like really bad cramps, if they're like cramped over like this for some reason, then may need to situate them a different way.
Yeah, so if they've got pain, you might accommodate their pain.
Yeah,
because we don't feed them, so that's not going to be children. But also it might be being aware of particular points. So if, say, for instance, you rub neurolymphatics that are on the abdomen, might accommodate that. Just rub lighter or get them to rub it themselves. The lymphatic system, one of the things that can happen with the lymph system is people can get lumps that they're not aware of, and you might identify them as you're palpating different areas, or, you know, if you're rubbing here and you notice a great big lump here, and I have done in massage, I've said, look, this lump to me suggests it's a swelling of the lymph, and I would like you to get it checked out with your GP. Now, it may be a short-term thing that's not an issue at all, but that's not up for me to decide.
Yeah.
So, and often I've heard the GP say, oh, no, that's just a bit of a swollen lymph thing. It doesn't matter. It's okay. But if they went back 6 months later and it was still there, that then might become a concern. So it's, so with that kind of swelling, it's just being aware. You might also see some edema in the feet, you know, swelling in the feet, and that often represents kidney and heart issues.
Oh, okay.
Because the heart, the pumping of the arteries isn't enough to push the fluid back up via the veins, and the kidneys aren't able to filter enough water out of the system, so the system it gets overloaded. If anyone with edema of their feet, I always try and get their feet up a bit higher than their heart during the session, just to keep them comfortable. It's a, you know, good therapeutic situation. If they're on medications, I would send them back to their GP to get them reviewed. Things that you assume medical people would handle don't always happen. So we actually have to be better than them. We have to be able to ask questions and see things differently, and then present it back to them for a change. So you don't know what you're going to get in your clinic. People just come and we don't know what situation they're in. Anyway, the immune system, any guesses?
Oh, like autoimmune diseases. Lupus.
So how would you deal with someone with, say, for instance, lupus?
I know of it, but I don't know how it affects people actually, so I wouldn't know.
So that says to me maybe that one's not as common, but if we looked at, say, maybe arthritis, which is similar in a way, do you know how arthritis might affect somebody?
Yeah, well, I mean, for example, you know, I get that, I mean, tendonitis, arthritis, but like I get it in my wrist. So sometimes when I'm being muscle tested, it can get quite sore.
So modifying pressure to suit the person's ability. And I don't know if you've seen any of the videos that I've done with mum and dad. There's also been a restriction of movement. So when we expect that the person can move their arm in a particular direction, sometimes they just can't do that. So you actually have to modify your muscle to accommodate that. The other thing with autoimmune stuff can be fatigue is quite common, and that would mean being aware of not taking 2 hours with that client. You know, like if you've got somebody coming over to practice, you might only work with them for an hour rather than 2, or even less, depending on that person. And one of the things that often happens with new students is they're trying to get their stuff in their head, and they're a little bit slower, and they're kind of determined to keep going until they get to the end of the process. And it might just mean you have to practice the first part of the process and get faster at the first part before you get to do the second part. So modifying how much you're prepared to work with when somebody isn't physically capable of lasting for hours. The reproductive system. Endometriosis is really, really common. So lots of women come with painful periods or heavy bleeding, and it's just part of their life. They don't always realise that kinesiology can be useful for that. In terms of modifying your treatment plan, it might be about making sure that they're comfortable if they've got pain at that time. The endocrine system, often people are highly stressed, so their adrenals are quite worn out. The adrenal system is pumping out either adrenaline or cortisol to deal with the stress that they're under, and you can see a lot of fatigue and burnout in that respect. But in terms of modifying your treatment plan, probably that's more about knowing what techniques you've got in your kit bag later on along the line. Rather, like if anything to be aware of, you wouldn't say my adrenals are burnt out.
Yeah.
So I feel exhausted.
Yeah.
But like for some, generally people who are exhausted aren't going to come to the practitioner. They're going to cancel. But when you're working in class, student to student, it is possible to get to that exhausted stage, or something come up. So one student is particularly vulnerable, and we need to be able to have the opportunity to check in with the client or the volunteer that they actually have the capacity to work on this right now. Because if they don't have the capacity, then you just do something that is gentle and caring, and get them to come back. And in the student situation, if they don't have the capacity, then they have to make a decision about learning that particular bit of information.
Yeah.
Yeah. The nervous system. We could have headaches, migraines. People will come to sessions with headaches or migraines. Generally, I just ask what their pain level is and check that the lighting is okay. If somebody has consistent headaches, it really should be checked out by a GP.
Mm-hmm.
At our clinic in Hervey Bay, we had a GP send a client for bone therapy because the headaches weren't being resolved. But at the same time, that GP simultaneously took bloods, and it came back that that patient had meningitis.
Wow.
Yeah, and it was a really rare form of meningitis, and he was immediately taken to Brisbane, put into hospital in Brisbane. So
Yes.
we don't always, and so the GP sent somebody for a headache, give them bone therapy to relax them. Okay, we'll see if we can reduce the pain level, but there was actually something sinister underlying that nobody knew. Yeah. So, I mean, that's going to happen occasionally. Not common, but occasionally. But nervous system problems, if somebody has a lot of unlocks on one side of the body, what would you suspect could be happening? So muscle weakness, all one side of the body.
Like something to do, like an issue with their brain, or like yeah. Yeah,
so think about your people that you work with yourself as a carer. If you went to visit somebody and you found they had complete weakness on one side of the body,
call an ambulance.
Yeah. Yeah, because it could be a stroke.
Yeah.
Yeah. I mean, when you're getting some feedback with the muscles and you can fix them, then that's not a stroke because they can be fixed. But if you've got lots of weakness and they can't be fixed, then you would refer to the GP to assess this one-sided weakness that isn't improving.
Yeah.
Yeah. And because the thing about the stroke issue is they may have had a minor stroke at home earlier, and the longer that you wait, the more detrimental it is to the body. The sooner the person who's had a stroke gets seen to, the better. I think that's the same with a heart attack. If they've had a heart attack, the sooner they get medical intervention, the long-term impact is better.
Yeah. Yeah.
And then senses, we've got things like vision. If somebody's having double vision, you might be concerned about that. Hearing, usually that's a gradual thing, or it's an industrial thing, so it's not really something I'd be looking for. But if somebody had a hearing issue, I'm going to make sure that I face them and, you know, I adjust my communication to suit them. One of the other systems that I haven't put in here is the musculoskeletal system, like back pain or frozen muscles or whatever. You're going to adapt that.
Yeah.
You know, you're going to be cautious if you've got broken bones or recent surgery. But here, the next part was the 6 potentially serious medical conditions, and we have mentioned a few of those in what we've said. But the question says how you would recognise each one. Now, if I was working in any kind of health or supportive, like a carer's role, I would use my carer's knowledge there and say, well, if I was arriving somewhere, what kinds of things would be concerning for me? And we, in kinesiology, we call these red flags.
Okay.
Yeah. So these are conditions that should immediately be referred to a medical person, because delaying the treatment could be life-threatening.
Yeah.
Yeah. And just another aspect of that is if we look at what's written in the unit of competency. So this is what the accredited qualification, what we should be teaching you is what are the contraindications to balancing. So the first one is an unwillingness to accept the self-responsibility model. So it's, you know, I want you to fix me. Well, we don't do that, but that's not a medical condition. That's just a contraindication. The next one is the client has an expectation for medically determined pathology parameters, which is, you know, can you tell me if I have cancer? No, we can't test for that. You're going to have to go to your doctor and get that information followed up. I mean, they could also be saying, can you tell me if I'm pregnant? No, go and pee on a stick. You know, but people will, you know, can you tell me the sex of the baby? No, go and have an, you know, because, you know, there's this perceived magical, all-knowing clairvoyance with the muscle test that is not necessarily appropriate.
Yeah.
But then the last one, which is probably important for us right now, is the presence of infectious diseases suggested by fever, nausea, lethargy without receipt of a diagnosis from a medical practitioner. So generally, anyone who's having fever, feeling nauseous, and it says and lethargy. So I wouldn't be saying or lethargy, because you're going to get lethargy with lots of your, you know, your Epstein-Barr, Ross River, undiagnosed polymyalgia, fibromyalgia kind of stuff. There's lethargy with a lot of those things, but when you add that to fever and nausea kind of stuff, then it's not our realm. We're not an infectious disease person. And then, so what you're looking for in that one is what are the conditions and how would you recognise them? So before we were talking about, well, they might have had a stroke, how would I recognise weakness down one side of the body? They might be having a heart attack, pain in the left side of the chest and the arm. And then the final question in this group is 6 conditions that you might encounter as the role as the therapist that would require referral to another practitioner, and name the discipline involved. So going back to that unit of competency, this is coming from HLTKIN 003. The indicators for referral include the client expectation of a treatment for a named medical disease or condition. So if they want to be treated for that condition, we need to make sure that they're already under the care of a medical person. We might work in conjunction with that medical person, or alongside of, but not instead of. Undiagnosed pain. So particularly, we were talking about irritable bowel kind of stuff.
Yeah.
Undiagnosed pain in the bowel might be, for example, diverticulitis. And if you get one of those pockets of the diverticula that bursts, that's life-threatening.
Right.
Yeah. So when we say undiagnosed pain, we don't just mean I've got a sore arm or a sore back or whatever.
Yeah.
We mean that pain that perhaps needs some investigation. Don't just assume that all pains are just pains.
Yeah.
Often with young children these days, I see them, they come in with tummy pain. They've already been to the doctors to get it checked out, and there's a potential that it's anxiety.
Yeah. So
they come in with a tummy pain, but it's already been diagnosed as nothing that they're worried about. So sometimes I'll still work on that client. I'll still give them their session, but I will give them the referral to the GP on their way out. So you need to follow this up. If this pain could be something worse, so even though we've already done this, please go and get that sorted.
Yeah.
So say you had somebody who had fallen off a motorbike and came in with a bit of back pain, neck pain. That is, even though we know where the issue came from, that's undiagnosed.
Yeah.
Because we don't know what's happened to the spine in that fall.
Yeah.
So you would have to refer them to a chiro or a GP or the accident and emergency to get a scan, and for that to be reviewed by medical people before you start testing muscles or, activating points.
Yeah.
I wouldn't even do.
You wouldn't touch them.
No, in those situations, I wouldn't touch it. So if somebody's had an accident and they've got problems, I wouldn't touch them. But say they had a car accident 2 months ago and they're still getting headaches from the whiplash, then I would, because the medical people have already had a shot at it and it didn't do a good one.
Yeah.
So that undiagnosed pain means that pain that should have been diagnosed that hasn't been.
Yeah.
And what the rules are, it's a bit nebulous, but what we have to be aware of is what we don't know.
Yeah.
That's the big thing. Infection or infectious diseases, we've already talked about that. Undiagnosed lumps and tissue changes. So we talked about in the lymph, but that could also be like a skin cancer situation. If you're seeing those tissue changes, you might suggest that they go and get it checked out.
Yeah.
Unexplained inflammation, swelling of places that that the client doesn't understand, you don't understand, is a good thing to get checked out. Unexplained thirst, diabetes. Oedemia is that swelling, and particularly in the feet if it's unexplained. So if they've got swelling in their ankles and their doctor's never reviewed that, it should be reviewed. If they've been with their doctor for a few months or whatever and they say, we've been watching it, then you would just balance, and I would maybe suggest a second opinion. Because sometimes that happens. Mood swings, indicators for referral. So it's not saying we can't work with someone with mood swings, but it's saying mood swings, anxiety, depression may be outside the scope of what you've got in your toolbox to deal with. Any indications of self-harm or loss of willingness to live or desire to live, all of those things should be referred on to a psychologist or counsellor or psychiatrist, not just for the client's safety, but for your safety. You don't always know when clients have mood swings, you don't always know if they actually have a diagnosis that they haven't told you about.
Okay. Yeah.
And that can put you at risk. So when you see mood swings in a client, sometimes it's good to say, do you actually see a mental health professional? Have you got any help? Or do you take any medications that support you with this, and get that information?
Yeah.
You usually don't see those when you're getting friends and family turning up. It's more when you're hang up your shingle and you get people from the public, you start to see people with more complex mental health issues.
Yeah.
But that's not to say that we can't work with them. Kinesiology can do amazing work, especially in the anxiety and depression areas. But you just don't want to be an island and on your own and not having professional support for the client or yourself. Bleeding and bruising. So what we're talking about here is that is not going away. You know, so if you've got an elderly client who comes in and they've got lots of bruising and here, you would want to get them referred back to their GP and check that they're on the right meds. They're probably on a blood thinner that's going over the top and it needs to be pulled back. Yeah, or maybe they're on a blood pressure tablet that's making them bleed. Yeah. Nausea, vomiting or diarrhea, we've kind of already talked about that as an infectious disease, as well as fever. Sudden loss of weight. So sudden loss of weight, I think they would normally put in it could be a cancer of somewhere basket. Yeah. So they're the things that are in the unit of competency that they say that we should be referring because of those. So you would just cherry pick one of those, a couple of those, and say, this is this condition, 6 conditions that might require referral to a practitioner. Yeah, just pick a couple and write them down, and then it says the relevant practitioner that you might send them to. So, you know, you might have muscle weaknesses that aren't improving, and you could try a chiropractor or a physiotherapist for that. You might have complex dietary stuff that is beyond the scope of a kinesiologist. So you might send them to a nutritionist or a dietitian or even a naturopath.